Hi, my name is Kweko. I am a pharmacist. In this video, we'll discuss essential information about the medication amlodipine, one of the more common and popular medications that is used to manage high blood pressure. So we're going to cover what it is used for, how it works, who should be careful using amlodipine, how and when to take it, some side effects, and some potential drug interactions, as well as some precautions and best practices that you should be aware of. And as in all my other videos, this is for informational purposes only, so please do not stop, or make any changes to your medication without first talking to your doctor. Amlodipine is typically prescribed to treat high blood pressure or hypertension, as we sometimes call it, and a type of chest pain called angina. Now, amlodipine belongs to a group of medications known as calcium channel blockers. It works by affecting the movement of calcium into the cells of the heart and blood vessels. Now, calcium plays a key role in muscle contraction. In muscle cells in the heart and blood vessels, calcium enters the cells through what we call specific channels. Now, by blocking these calcium channels, amlodipine prevents some calcium from entering these cells. This causes the muscles in the walls of the blood vessels to relax, allowing the blood vessels to kind of widen. Now, the widening of the blood vessels, something we call vasodilation, makes it easier for the heart to pump blood throughout the body. This leads to lower blood pressure and decreased workload on the heart. Now, while amlodipine can be very helpful for some people, it may not be suitable for everyone. There are certain situations where you absolutely should not take it, and in some situations where you need to be careful and definitely take a look at your medical history before even considering amlodipine. Now, you should not take amlodipine if you are allergic to it, obviously, or to similar medications, which we call dihydropyridine calcium channel blockers, the most common of them being one we call nifedipine. Amlodipine is also a no-go if you have a condition called severe aortic stenosis, which is a narrowing of the aortic valve in your heart. If you have unstable angina, which is a chest pain that is increasing in frequency and severity, amlodipine may not be the right choice for you. Also, if you have heart failure with reduced ejection fraction, in certain cases, amlodipine may be problematic. So you and your doctor will have to discuss if you still need to stay on amlodipine. Now, if you have liver problems, your doctor may need to adjust your dosage, so be sure to let your doctor know of any medical history. And also, if you're an older adult, you might be more sensitive to the side effects of amlodipine, so your doctor will likely start you on a lower dose and monitor you more closely. All right, now let's talk about how to take amlodipine properly. First and foremost, the dosage is always determined by your doctor. I cannot give you any specific dosage recommendations, as the dose depends usually on the condition that is being treated and how well you tolerate it. Generally speaking, though, the usual starting dose is 5 milligrams once a day. If the starting dose is not working well enough, for example, if your blood pressure doesn't get lower or your angina isn't controlled the way your doctor expects it to, he or she may increase the dose to about 10 milligrams once a day. It's usually taken once a day, and it can be taken with or without food. It doesn't really matter. What does matter though is trying to take it consistently. Try and take it at the same time each day. This kind of helps the level of the medication in your body to remain steady and constant, and makes the medication work more effectively. So what happens if you miss a dose? Well, you can take it as soon as you remember, unless it is almost time for your next dose. In that case, just skip the missed dose and take your regular dose. You really should never double up to make up for a missed dose. This can be dangerous. It's also important to remember that amlodipine is often a long-term medication. It's not something that you take for a few days and then stop. It's usually prescribed for ongoing management of high blood pressure. So just be careful of that and avoid abrupt discontinuation. Now let's talk about some side effects. Like all medications, amlodipine can cause some side effects, although I must state that not everybody experiences them. Well, it's just important to be aware of them so that you can discuss any concerns that you have with your doctor. Some of the more common side effects of amlodipine include a headache, dizziness or lightheadedness, swelling in your ankles or feet, something we call edema, which is very common, unfortunately, flashing of the face, palpitations, which are feelings of your heart racing or fluttering, and fatigue. Now, these side effects are usually mild, and for the most part, they tend to go away as your body adjusts to the medication. However, there are some less common but more serious side effects that you should be aware of. And these include, excessive dizziness or faint to the point where there is fainting, if there is chest pain that worsens, if your heartbeat is irregular, if there is shortness of breath. These are the ones that if you experience, you may want to seek medical help immediately. Now, here are a few tips to help you manage some of these side effects. Now, what you can do is that, say, for example, for the swelling in the ankles and feet, sometimes elevating your legs can help. But then again, it's really important to, keep the communication lines open between you and your doctor. They can assess the situation and give you personalized advice. Sometimes it will mean reducing the dose, or sometimes it may mean discontinuing the medication and switching you to something completely different. Next up, let's discuss drug interactions. Amlodipine can interact with some other medications, supplements, and even certain foods, potentially causing problems. Now, while I cannot list every single possible interaction, at least I can give you a few examples of medications that are known or that can sometimes interact with amlodipine. The first on my list here is statins, which are cholesterol-lowering medications, very popular these days. Typical examples are atorvastatin, simvastatin, and rosuvastatin. Now, these can interact with amlodipine and increase the levels of these statins in the blood, potentially increasing the risk of muscle pains or something called myopathy, which is associated with statins. Now, I'm not saying here that anybody that takes a statin can never take amlodipine. However, your risk for developing muscle pain is a little bit higher if you're taking both medications concurrently. So this is something that you need to watch out for and discuss any issues with your doctor. The next group of medications are antifungal medications, something we call azole antifungal. So for example, ketoconazole, itraconazole. These can inhibit the enzymes that break down amlodipine, leading to higher amlodipine levels and increased risk of side effects. Another category of medications is what we call macrolide antibiotics. Now, macrolide antibiotics, typical examples are clarithromycin and erythromycin. They can also affect amlodipine metabolism, similar to the antifungal medication. So a lot of times, if you have to be on a macrolide antibiotic, I've seen instances where the doctor would say, hold off the amlodipine for just a couple of days while you finish off the antibiotic and then kind of go right back, all the while monitoring your blood pressure just to make sure that nothing crazy is going on. Now, in terms of food, I'm sure you've heard this before, and your grapefruit or grapefruit juice can significantly increase amlodipine levels in the blood, potentially leading to more side effects. So it's generally recommended to avoid grapefruit juice while taking amlodipine, or discuss with your doctor. Maybe they may make certain exemptions for you. Another thing is herbal supplements. Some herbal supplements like St. John's wort can interact with amlodipine. So needless to say, you must tell your doctor about all the supplements that you're taking for them to have a comprehensive look and decide if amlodipine is still good for you. Now, amlodipine can sometimes cause dizziness or lightheadedness, especially when you first start taking it, or when your dosage is changed or increased. So be careful when driving or operating machinery until you know how your body reacts to amlodipine. It's always better to err on the side of caution. Another thing to be mindful of is alcohol. Alcohol can sometimes interact with amlodipine and worsen the side effects like dizziness or even sometimes low blood pressure. And also, I mentioned this earlier, it's important to not stop taking amlodipine abruptly without first talking to your doctor. Sudden discontinuation can sometimes cause a rebound in blood pressure, and which can be dangerous. So your doctor would, if you have to go off it, usually your doctor will, safely kind of wean you off or taper it off gradually and replace it with something else. I truly hope you found some value in this video. If you did, please give it a thumbs up. Stay blessed, and I'll catch you on the next video.